Hello and welcome to the Silver Access Orientation for 2023, presented by Vanessa Corpus, which is me, the Silver Access Program Coordinator. For this orientation agenda, we're going to talk about any 2023 updates, what has changed within Marketplace. We're also going to briefly talk about the benefits within each carrier. We have Blue Cross Blue Shield, we have Cigna, Embedded, and what are the benefits that the carrier would give to its policyholders, and we can be able to use under that insurance. We're also going to briefly talk about the different terms and terminology for health insurance, and we will briefly go through a review for Silver Access, how Silver Access works, and what is our duty for us to be able to pay your monthly premium on your behalf. Now, my name is Vanessa Corpus. I am the Silver Access Program Coordinator for this year, and this is the first year that I'm working with Silver Access. Previously, I was the administrative assistant for Access DuPage, and before that, I was a volunteer as the enrollment specialist. So I was helping people with their Medicaid applications. So I've been within the organization for DuPage Health Coalition for about 4 years. But this year is definitely a learning curve with Silver Access, especially filling in the big shoes that Marina Sidori left. She was a previous program coordinator for the program. Now, what are the 2023 updates? So one of the coolest things is that the government put in a new special enrollment period for those with low income. So you do have to be under the 150% of the family poverty line for you to be able to qualify for this special enrollment period. And they call it special enrollment period because it's outside of those states for open enrollment. So open enrollment, as a reminder, is from November through January 15th of 2024. So for you to be able to change plans, you would have to wait for open enrollment. But if your income is less than 150% of the family poverty line, you're actually able to change plans anytime during the year. And you're also able to, if you're not active with insurance, you're also able to apply during the special enrollment periods. So for you to figure out if you are under that poverty line, the federal poverty line, you can check the annual income as well as your family size. Then you should be able to see if your income is less than this. If so, then you're able to change carriers, you're able to change plans. If the current plan that you have you're not comfortable with, you're not able to use it to its full potential, you can be able to change plans. Okay. Now, if your income is above the 150% of the family poverty line, you would have to wait until open enrollment for you to be able to change plans for the following year. Now, in the case there's any circumstance changes in your household, whether you lost health coverage, moved, you're getting married, or you had a child, or adopting a child, or you gain a dependent on your tax return, that's when you will qualify for a special enrollment period, which means that you're able to change policies, you're able to change plans, but only if you had one of these circumstances in your household. Now, for 2024, the open enrollment date, it usually ends January 15th, but January 15th for 2024 lands on a holiday and lands on Martin Luther King Day. So they're going to extend it for one more day. So the actual end date for the open enrollment period is going to be January 16th. Okay. Now, it is very important once you're active with a policy within Marketplace, it is very important to report any changes, whether you lost the job, maybe you gained a job, maybe you have a child, maybe you moved to a different address. Make sure to report these changes. Remember that whatever changes you have reported on your Marketplace plan or your Marketplace application would have to reflect your taxes for 2024. So whatever income you reported, make sure it's going to be around the same when you do your taxes for 2024. Otherwise, if you end up reporting less than what you actually make, you may have to pay those tax credit back to the IRS. So to avoid that, make sure any income changes you report back to Marketplace. Now you're able to call Marketplace directly They can go through the application and make the changes, but you're also able to log into your healthcare.gov website to your account, and you're able to report the changes there. Once you report the changes there, you would have to go through the whole application and then just report what has changed. Now, if that's something that you're unable to do, if you don't want to talk to Marketplace, you can always go back to the agent that helped you do the Marketplace application initially, as well as the um, Silver Access application. So if you have somebody, if you have an agent, if you have a navigator, or maybe I helped you with the application, you're able to come to me and I can be able to go through the changes and report any changes on your behalf. We would just need your login information. Make sure to contact me if that's a situation that you're coming through in your house. Now, once you do the marketplace application, there's some circumstances where they need to verify your citizenship. Maybe they need to verify your income and they're asking for proof of income or proof of ID. That's something that you do need to send back immediately. They usually give you about 60 to 90 days for you to send those documents back. Otherwise, they will cut you off from any health insurance that you have through the marketplace if you don't send them back. You may also risk of losing your tax credit, and these are hundreds or even $1,000 a month that you're getting. So we don't want you to pay the full amount. So make sure to send any documents that they require from you. And they usually let you know through email, through mail. They send you notices by text. So make sure you're on top of that. We don't want you to lose tax credit. Okay? Now, this year we have one, two, three, four, five different carriers, and I know Molina is one of them. We have not included them here because they have not partnered with Silver Access yet. But every carrier has its benefits for its members. So, for example, Blue Cross Blue Shield has something called Blue 365. So it gives you access to discounts on brand name products like Reebok, Skechers. So you're able to make orders online and you're able to receive these discounts using your Blue Cross Blue Shield membership. What's also something really beneficial is the app. So if you are under Blue Cross Blue Shield, you have an active policy with them, you're able to create an account through Blue Cross Blue Shield. You're also able to download the app on your phone and you can be able to keep track of your out-of-pocket costs, any co-pays, any out-of-pocket maximums. You're also able to view claims, you're able to find providers, and also you're able to add your ID card to your wallet. So if you have an iPhone, you're able to add the Blue Cross Blue Shield ID card to your wallet for easy access. One of the things that I love telling people about Blue Cross Blue Shield is a program they have. It's called Well on Target. So it's a fitness program, and you pay a monthly fee of, I believe, $30 or 29. I believe it goes from $19, 29, and then $40. They have different tiers, but you have access to hundreds of different gyms in the area. So, for example, if you were to pay the $19 a month, you have access to Planet Fitness, you have access to LA Fitness, Anytime Fitness, and you're able to go to any of these gyms with that membership, right? So that's something for you to keep in mind if that's something that you're interested in. Take advantage of this. I use it. Um, if you have any questions of how to sign up for it, feel free to reach out. But it should be easily accessible on your Blue Cross Blue Shield account. Now, for those with Better policies or insurance, once you're active, you're able to earn points easily just by completing a survey once you create an account with them better. Just completing the survey gives you 500 points, which is $50, right? Once you go to your annual exam, they give you an additional 500 points, which is another $50. If you get your annual flu vaccines, uh, you get 250. This is $25. So once you collect points, you're able to redeem it for a gift card in which you're able to use it for co-payments, for any utility bills, transportation, rent. deductibles. So you can use this gift card for pretty much anything. So if you have an Embedded policy, you're already doing all of this. So might as well take advantage of the points, get that reward back as a gift card, and you should be able to use it for any of these subjects. For those with Cigna, if you have an active policy with Cigna, one of the cool benefits is that they give you a certificate for 1 year membership of Costco. All right, so you're able to log in into your Cigna account. If you have not created an account, make sure you create one. Should be fairly easy. You're also able to see your claims, how much of your deductible you have accumulated. One of the benefits is that you get a Costco 1 year membership certificate. You also have access to discounts for Fitbits and Roku streaming players. Right? Now, just like Mbetter, you're able to use these, you're able to get rewards by doing surveys, by doing activities within the app, in which you are able to redeem that as a gift card as well. And you're able to use that for things like Costco's, Fitbits, and Roku's. Okay. Now, once you go to the clinic for any medical services or you go to the hospital, you get an explanation of benefits. This explanation of benefits is just a notification provided to members when a healthcare benefit claim is processed. So before you receive a bill from your doctor's office, you will receive this explanation of benefits, letting you know how much of Blue Cross Blue Shield will cover towards that service. It may look like a bill, but it's not a bill, right? So this is just for you to keep in mind when you receive an EOB. And there's different sections within the EOB that are going to be very beneficial for your policy and for you to be able to keep track of. So, for example, once you receive an explanation of benefits, just make sure it has the right information. Make sure it's your name. Make sure it's your date of birth is correct. Make sure your address is correct. All right. First of all, we want to make sure that this is, under your name and it's going to be under your policy. Now, Section A will represent the amount submitted. So, what are the total charges of when you went to the health center or when you went to the doctor? And what Section B will be what Blue Cross Blue Shield covered towards those services and how much it will pay. Most likely, this is the amount you will end up paying. So, most likely, this is the amount on the bill that you will be receiving from the clinic or whichever medical service that you had. What's also something really cool with the explanation of benefits, if you turn the page around, it's going to show you your current out-of-pocket maximum balance. So if you have to pay any co-pays, anything towards medications or doctor's office, this anything that you pay towards these medical services will go towards the deductible, in which the deductible will go down. Once it hits zero, that's when most of the services will be covered by your insurance in full. Okay, so this will give you an idea of how much of that balance is remaining and how much your total out-of-pocket maximum is. All right, now towards the end of the explanation of benefits, it's going to show the claim details. So who is making a claim, well, which doctor's office, which clinic, what is the address? Make sure that information is correct as well. We want to make sure that the claim is coming from the correct doctor's office that you went to, just to make sure that we have the right copay that you're responsible for, which most likely would be the 495. And again, this is just an example, but it's just very useful for you to keep track of within your doctor's office and clinics. Now, every month you will be receiving this reminder, whether it be from Blue Cross Blue Shield, Embedded, Cigna, Molina, United Healthcare. Uh, you can completely disregard this because Silver Access will make full payment on your behalf directly to the carrier. So you can completely disregard this. Now, you may also receive paper notices in the mail letting you know that this amount is due, or letting you know like you need to pay this amount. You can keep that paper for your records, but completely disregard it. Keep in mind, Silver Access will make full payment for your policy. Now, when you sign up for an insurance at the end of the marketplace application, make sure to make the first payment always and do not sign up for automatic payments because following on that first payment that you have made, Silver Access will make full premium payment for the rest of the year. Now, how does Silver Access work? What is the work behind the scenes? What did it entails? How do we make payments on your behalf? So basically, I have a point of contact within each carrier. So I have a representative from Blue Cross Blue Shield, a representative from Cigna, Embedded, United Healthcare, Oscar Health. And what I do every month, about the 15th of every month, is that I send a list of the people that are Silver Access within that policy. So, for example, Blue Cross Blue Shield, to the representative, I send a list of all of the Silver Access members that have Blue Cross Blue Shield. I include their name, their date of birth, how many people are under the policy, and how much is their premium that was reported on the application. What they do is they verify if the policy is still active. They verify that the premium is still the same, and if it has changed, they will let me know. They will also verify if you have terminated your policy. They will let me know if the policy has been terminated by you or if it was terminated for any reason. They would also verify if the number of people in the household is correct, just for us to be able to make the full payment before the end of the month. Once we have that list, we make the full payment for Blue. It's different for every carrier. So for Ambetter, for example, I make payment for every single person. I have to go to a patient portal, input their information for every member, and then make a payment there. For Blue Cross Blue Shield, for example, it's about 300 people under the Blue Cross Blue Shield within Silver Access members, but we make a one-time payment for that. So we just add up all the premiums for all of our Blue Cross Blue Shield members and we make a payment. For Oscar Health, we send checks for every individual premium. And United Healthcare, we make a call for every individual premium, right? So every carrier is a little bit different of how we make payments. But that's basically it. And this is what we have to do every month. Mhm. Now, within the approval packet that you receive with the Silver Access program, and you usually receive the approval packet once you are approved, the last page is going to be the member responsibility acknowledgement. This is a document that needs to be signed by you, letting us know that you agreed that you will pay this amount because that is your responsibility as a Silver Access member. It would also include, your name, your monthly premium, and it would also include monthly payment plans. So if you do have an outstanding balance, I will give you options, whether it be if you want to make a one-time payment for the full amount, or you're able to sign up for automatic payment plans. So this will let me know how you would like to pay and that you agreed to be under the Silver Access program. So make sure if you have not signed this, make sure you do sign it and send it back. You can send it to me by email. You can drop it off here at our Carol Stream office. You can send it by fax, or you can sign it electronically. If you are not sure that you have signed this document, make sure to contact me. I will let you know if you have or have not. If you need a copy of it, I can also send you a copy of it by email and mail. But if you do need to sign it, I'll be more than happy to let you know and give you the link if you want to sign it electronically. Now, as a Silver Access member, you do have a responsibility of 1 to 3 months of your premium payment, all right, for the year. So depending on your income and family size, we will calculate to see if you owe 1, 2, or 3 months of your premium for the whole year. Silver Access will cover the rest. Keep in mind, Silver Access only covers for $150 per person per month. Right. So you are also, as a Silver Access member, you are also responsible for what we call an overage. The overage will be the difference of the assistance we provide you and your premium. So for example, if your premium is 160 and the assistance that we provide you is 150, you will be responsible for those $10 difference per month. All right, so that amount will also be included in your outstanding balance along with the months that you're responsible for. Keep in mind the first premium payment you do pay out of pocket, so we do put that in account. So for example, if your income is around the 101 to 150% of the family poverty line, then you will owe 2 months out of the year. So if you make the first binder payment out of your pocket for January, that means you would only be responsible for one more month and any overage if you haven't. Okay? And this will also be explained on your approval packet. Now, if you do have an outstanding balance with Silver Access, these are the options that you're able to do in regards to making payments. You're able to mail in payments. We only accept checks and money orders. You can also do an electronic auto payment plan. So I have links on our website for Silver Access in which you're able to make a one-time payment for the full amount, or you're able to sign up for payment plans depending on what your um, member responsibility acknowledgement said. You're also able to make a one-time payment. Again, you can do this online or you can send in a check or a mail order to our office. Now, just like every year with Marketplace as well as Silver Access, you are responsible in doing your renewal. So if you do need assistance, we have the health department. You can also go back to your broker, to your agent that help you sign up for Marketplace. But make sure they to also do the renewal for Silver Access once you do your renewal for Marketplace. All right, just every year you do have to renew. It doesn't roll over like your insurance. Now, if you do not make your binder payment, which is the first payment you have to make for your policy to become active, uh, we would not approve you, first of all. If you don't sign in your MRA, which is your member responsibility acknowledgement, if you don't sign it and turn it back in, we may terminate you from the Silver Access program. If you do not make any payment or do not make a payment plan towards your outstanding balance, we may not approve you for the following year. And if you do not attend orientation, we may not approve you for the following year. So make sure you have all of this done before open enrollment or before the end of the year. That way, once you apply for 2024, then we're able to approve you immediately. If you are unsure of any of these, if you're unsure if you have done any of these, go ahead and give me a call. You can also email me, you can ask me, and I'll let you know if any of these are missing. All right, now if you have any questions in regards to this orientation, you can always contact me. My contact information is going to be towards the end right here. So this is my direct phone number and also my email address. So if you have any questions, if you come across any problems, any issues, make sure to give me a call, make sure to send me an email, and I'll be more than happy to assist you. But again, it was nice working with everybody this year. Again, any questions, feel free to contact me. Thank you.